Hi everyone. I'm going to be doing your lecture for Friday. Hopefully you're in school. I hope all of you and your families are safe. Your homes weren't destroyed. The videos that on the news are just horrible. I hope everybody is okay. I'm going to be doing this lecture because I'm not able to be at the school, on video and on Friday. So we're going to do the eye. This is a short chapter, but it's very important. And your test is not, we're not going to have a separate test for the chapter 14. It's going to be integrated into your final. So I've got your study guide all prepared for that, and that's in Google Classroom. And this PowerPoint's on Google Classroom with a video I want you to watch for the process of your hearing. So we're going to start with the parts of the eye. You've got the sclera, you've got the choroid, and then you've got the retina. The sclera is the outer part of the eye, and that's what you see the white of. And this adds strength, structure, and shape to the eye. The choroid is a dark blue vascular layer between the sclera and then the retina. And so this has some pretty important parts. It has the lens and the pupil to it, and it's got the I'm sorry, I lost my train of thought. It has the iris and the lens to it. That is the lens protects the eye, and it also has these suspensory ligaments on it. And then you've got the pupil, which dilates and constricts. And then you've got the iris, which is your color part of the eye. And we all have different color irises. I have green eyes. There's blue eyes. There's brown eyes, dark brown eyes. There's hazel eyes, which are like a brown green. So we all have different color irises. The on your retina, and this got left off, and I apologize, but the retina is very important to. It's got the nerve in back that attaches. It attaches up in the choroid and comes through to the retina, and this is what sends images to the brain, and then it reflects into our eye. So your retina is very important. This is the back part of a camera. When you have a real camera, not your iPhone, you've got the lens, which is showing that, and it's got you can arrange it's called the f-stop on the camera, which allows how much light to come through. So you've got like the pupil, which that's what that does after the lens. And then in the back is the retina. And this is in the camera is a mirror that will reflect the picture, and it'll be upside down. But when you go to take the picture, it reflects upright. So it's really amazing how a camera works like the eye. On your eye, we've got different terms. And so I want you to know what accommodation is. Accommodation is where we look at something close up, and then we look at something at a distance. Our eye adjusts to that, okay? This is where the ciliary muscles help with the lens, and this adjusts so that you can see it. Presbyopia is presby, and remember, presby is a prefix for old age. So anything behind that is going to be age related. So presbyopia is when we're in our 40s, that's when our eyesight starts deteriorating. And so you'll see a lot of people looking at books, trying to put them further and further and further away from them so they can read it, because they can't read it up close without glasses. The retina is the innermost layer of the eye. It's responsible for the reception of visual impulses through the lens and impulses to the brain. Rods and cones, these are really important. Visual receptors, elongated nerve cells, are located in the posterior part of the retina. Now, the rods detect presence of light and function in dim light and produce images in black and white, not color, black and white. The cones reflect bright light in color. So we have approximately 120 million rods in our eyes and 6 million cones. So remember that. So men have a tendency to be more color blindness. They can't determine blue and black, and that is hard, the different shades of blue and black. And so some men will come out with 2 different color socks. My father-in-law, his wife had to make sure he had the right color socks matched because he would mix them up all the time. Your optic nerve gathers the visual stimuli from the ganglion neurons and transmits this information to the brain for interpretation. 2 fluids are in your eye. You've got the aqueous humor, which is located in the posterior and the anterior of the eye, so it's in both chambers. This drains through called a Schlemm's canal. Now, if this Schlemm's canal gets sclerotic or damaged, the pressure of the eye can increase, and this is another cause of glaucoma. So the doctor will check the pressure in the eye to see if it's stable. If it's going up, then we have an issue. The vitreous humor is the other fluid, which is located in the posterior chamber of the eye and gives shape to the eye. So the lacrimal glands, these are the tear glands, okay? This keeps our eyes moist. So on your eye, remember you've got the 3 layers. You've got the sclera, the choroid, and then the retina. Then you've got the accommodation, which helps you with distance and close up. There's also, you've got rods and cones. Remember, the rods are they function in dim light, and they only show black and white, not color. Your cones show the color, and this is in bright light. So remember those. So we're going to go to the ear now, and I want y'all to watch that video because it's short, like I said, but it is really interesting. And the bones in your ears are called ossicles. So keep that in mind, okay? So your ear is responsible for hearing, balance, and equilibrium. The external part, which is the pinna, is this outer part of your ear, is composed of the auricle or the pinna, collects sound waves, and this goes down into the auditory canal. This canal, it has ceruminous glands, which are wax glands, and this is what makes the wax in your ear. Now, this helps keep things lubricated and also catches bacteria and things like that. You're not supposed to stick Q-tips, bobby pins, or anything down in your ear because you can puncture the eardrum. So what people have to do, some people make a lot of the cerumen or the earwax, and they have to go into the doctor to have their ears washed out because that earwax can clog the ear up where the tympanic membrane, which is the eardrum, it can't hear. Okay, so they have to have their ears washed out. So the middle ear has a eustachian tube, and the eustachian tube is also the other name for it is a salping. Okay, now the other area that we heard about salping was in the reproductive organs, and that was the fallopian tubes, where you had the fallopian tubes removed with the ovaries, the bilateral salping oophorectomy. And so the salping means tube. So you've got two salpinges, the eustachian tube and the fallopian tube. But this eustachian tube, which is a downward sloping canal which connects the middle ear to the throat, allows air movement between the inner ear and the outer atmosphere. So this is where, if you're in a plane and you can feel like, especially when you're ascending or you're descending in the plane, you can feel your ears popping. If you're going up in the mountains, same thing. You can feel that pressure when you're increasing, your ears are popping. Tympanic membrane is your eardrum, and this creates a wall between the external and the middle ear. The tympanic membrane connects to the malleus, which is the first bone, the first ossicle in your ear, and it's called the hammer. And then you've got the incus, which is another name is anvil. And then the third ossicle is the stapes or stirrup. And the stirrup or the stapes is what connects to the cochlea, and it causes the vibrations there. Internal, also called the labyrinth. That's your internal ear. Labyrinth is like a maze, and so you've got this. You've got the cochlea, which is a circular thing that is like a snail. So this is the first structure, which is tiny and circular, filled with perilymph, which is a lymph fluid, and lined with organ of Corti. The cochlea receives vibrations from the stapes through the oval window, which causes disturbance or vibrations of the perilymph, which is in turn disturbs or vibrates the organ of Corti. So this is the whole process of hearing. The sound waves come down the auditory canal. They come on, they hit the tympanic membrane or your eardrum. That tympanic membrane is just like a speaker. So if you watch a speaker, when it's booming the music, you can see it vibrating like this, okay? So those are the sound waves. And so then the tympanic membrane hits the hammer or the malleus, which in turn hits what? The anvil or the incus, and then the stapes or the stirrup, and then that hits the cochlea and starts sending the vibrations down. And that is the process of hearing. Another function of the inner ear is to provide equilibrium, which is the sense of balance. So there's two kinds of equilibrium. You've got state of equilibrium, which is feeling a sense of balance when we are at rest. So when you're lying down, everything is still. But some people, when they're lying down, the room is moving, and this isn't good. Dynamic equilibrium is the sense of balance when we are in motion. So if we're moving, we want to make sure that we're walking that straight line, okay? So that our equilibrium isn't off. The vestibular system controls both forms of equilibrium. Endolymph is within. Now remember, endo is always within. It's pale translucent fluid within the labyrinth, which responds to changes in the body position based on gravity. So this is when you get up from a resting position and you go to sit up. But if you go from a resting position and stand up real quick, you might be a little dizzy. Okay, and this is where older people fall, and you try to have them sit on the side of the bed first and then get up, because they do lose their balance. So now we're going to do combining forms and the abbreviations, and there's going to be just a few in here that I want you to know them all, but some of them are kind of confusing. Acous is hearing. Audio is also hearing. We know audio, but acous. Bleph is the eyelid. There's a surgery that people have where, because the skin above the eye, on the eyelid, it falls down, and it really constricts the vision. So the doctor has to cut that inner layer off and stitch it together, and you can't tell anything, but it's a good surgery. Conjunctive, that's the conjunctiva, that's the lining in the eyelid. Dacra is tears. Diplo is double, like diplopia is double vision. Iro is iris, and also irido is also iris. Okay. Lacrum is the lacrimal gland, that's the tears. Marengo is tympanic, that's your eardrum. So marengo or tympano, a tympanic membrane. So your eardrum can be marengo or tympano. Anything with oculo is eye. Ophtho or opthal is eye. And optic is eye. So keep that in mind. But then when you get to oat, O-T-O, auto, that's ear. So anything with the OC or the OP, that is eye, and OT is ear. Phaco, and it can be with a C or a K, is lens, is your lens on your eye. Prisby, anything that has anything with Prisby in front of it, that's something to do with old age. Like I said, your salping is a tube, and so you've got two salpings. You've got the eustachian tube and the fallopian tubes. That's like cysto is bladder, your gallbladder and your urinary bladder. So you've got two bladders. Sclero is hardening. Now, on your abbreviations, you've got AST, astigmatism, and you've got cataract, this is uppercase letters, C-A-T, cataract. EOM, extraocular movement, and we'll get into these in the pathology. You've got G for glaucoma, or GLC for glaucoma. LASIK is laser assisted in situ keratomileusis. This is where a lot of people have this surgery so they don't have to wear glasses anymore. Perla is what we use in when we're doing patient assessments. We start from the head to the toes. So when we're up at the head and we're doing the eyes, on our nursing notes, it has Perla. And this is pupils are equal, round, reactive to light, and accommodation. And remember, the accommodation is the distance. When we do the light, we have a little flashlight pin light that we put in front of the eye, and we have to watch the pupil dilate and constrict. Abbreviation, retinal detachment. You can lose your eyesight on retinal detachment, and we'll go through that too. AOM is acute otitis media. Ear, nose, and throat. EENT. ENT is ear, nose, throat. Oh, EENT is eyes, ears, nose, and throat, when you've got the two E's. Sorry about that. Okay, let's go into the pathology. So your first of all, amblyopia. This is where it's called the lazy eye. And so the children, usually they try to pick this up when they're little. And so you may see a child with a patch over the stronger eye, and this is to help build, to strengthen that lazy eye. Astigmatism is abnormal curvature of the cornea that distorts the visual image. Cataracts are the cloudiness in the eye, in the lens. So with some people, if you look at them in light, you can see a cloudiness. I've seen it in dogs. Older dogs, they have cataracts. And if you look at a dog in the light, sometimes you can see the cataract. So if you've got an older dog, look in his eyes. Chalazion is a small benign cyst, which is a sty. This is no, I'm sorry, it's not. Small benign cyst in the eyelid formed. Yes, it is. It's a sty. Conjunctivitis is pink eye, not ping eye. It's pink eye. I'll correct that. Diabetic retinopathy. This is where you can lose your eyesight also. So this is from chronic diabetes. Ectropion is a lower lid. The lower lid, and this happens in older people for some reason. The bottom lid here turns out, and you can see the inside of the eyelid. Entropion is where the eyelashes and that lid goes inward. Glaucoma, this is the blockage of that Schlemm's canal, and so the aqueous humor is not able to flow, so this the pressure builds up. And I've got to correct myself. Hordeolum or hodolum is the sty. The other one back here was not. It's a cyst on the eyelid, and it's what I've got on my lower lid right now. I'm going to have that removed on the end of May. But hordeolum is the sty, and they're pretty painful. Hyperopia is farsightedness. Legal blindness. Now, if you see somebody and they say, well, I'm legally blind, but you see them able to see some images, they can. They're not total blindness, but they're legally blind. This restricts them, of course, from driving, but this restricts them from doing some kind of work. And so don't be confused if you see somebody that is legal blind, but yet they're able to see some images. Macular degeneration results in central vision loss, another vision loss disease. Myopia is nearsightedness. Nystagmus is involuntary back and forth. So the eyes go back and forth like this, kind of fast. And I don't know how they correct it, but I can't imagine having your eyes like that. We said what presbyopia is. Retinal detachment is another loss of vision, separation of the inner sensory layer of the retina from the outer pigment layer, caused by a break in the inner layer that permits vitreous humor fluid to leak under the retina and lift off its innermost layer, and it may cause blindness. Strabismus is a deviation or misalignment of the eye. So you've got one eye that's going to look straight and one eye that goes kind of cockeyed. So you don't know which one's looking at what, okay? So, but it does affect depth perception. Anytime it takes both eyes looking straight, being aligned, to have that depth perception. People that have eye surgery and have to wear a patch for a little bit, their depth perception is off. So your depth perception, you're not going to be able to tell how high that step is, or how, and so that stepping down or stepping up. So people do fall with that. Anacusis is total deafness. Total deafness. Labyrinthitis is that inner ear inflammation. Meniere's disease is where it's chronic, and it leads to progressive hearing loss, vertigo, and tinnitus. Otitis externa, maybe y'all have had swimmer's ear. You can get swimmer's ear from the swimming. You can get it from taking showers. The water gets trapped down in your ears and the bacteria grows in there. Presbycusis is progressive loss of hearing with aging. So remember the presby. Tinnitus is the ringing in the ears, and this can eventually cause loss of hearing, and it can also be caused from medication like aspirin. People that are on aspirin therapy sometimes have tinnitus. Vertigo is the feeling of spinning or moving in space. So vertigo is, it's awful. Audiometry. This is your common diagnostic test and procedures. Audiometry is detailed measurement of hearing with an audiometer. When someone goes in for testing, they put them in a soundproof room so they can accurately find out how much of a hearing loss they have. Cochlear implant. This is I don't know if any of you have seen it, and this is a great discovery of and creation for deaf children. It's an implant, and you'll see them with this. It goes inside, but they have this thing on the back of their head, like right by the ear here, and you'll see that. And this helps them hear the sound, and they're able to learn to speak. They're able to hear. I've got a nephew that has one, and it's amazing. And he's getting ready to graduate high school, which is cool. Enucleation, this is the removal of the eyeball. So this can be caused from cancer. It can be caused from trauma to the eye. I had one lady that fell on a blunt, like a pole or something like that, and they had to remove her eye. LASIK is the procedure in which a laser is used to alter the shape of the deep corneal layer after a top flap in the surface is open. And many people after LASIK surgery, they don't have to wear glasses. Phacoemulsification is the removal of the lens with an ultrasonic device to treat cataracts. So they're able to lift up that lens and then put it back down. The Ren test is with a tuning fork, and the doctor, I don't know if any of you have, when you've gone in for physicals, they put the tuning fork back here behind the ear, and then they'll put it on top of your head. Tonometry is measurement of intraocular tension to detect glaucoma. So that is the pressure in the eye. Tympanoplasty is reconstruction of perforated tympanic membrane. So if somebody ruptures their eardrum, they try to see if it's going to heal on its own. Sometimes it's not, and they have to do a tympanoplasty. Visual acuity test, that is that Snellen test that you stand in front of this chart and you read the smallest letters that you see. Weber test is another hearing test with a tuning fork. And that is it, my friends. So I want y'all to watch this. I want y'all to go over this PowerPoint again, and also watch that video. And I will talk to you later, okay?